First lab station I would like to go over is the Kibler standing assessment of the core. There are 6 movements that I want to demonstrate. The first one is going to be a sagittal plane assessment. So you would stand 4 inches from a wall, cross your arms, single leg stand if you can, back bend. If you cannot single leg stand and do it and you have a lot of postural change or a loss of balance, put a toe down behind you, stand on your leg and back bend. Repeat twice, then go to the opposite side. So that's sagittal plane assessment. The purpose of the Kibler standing core assessment exercises and assessment tool is basically to look at patients in more than one plane and do it in weight bearing, and also to assess concentric, eccentric control, as well as the functional motions and movements that we do with our daily activities. The second one is going to be a standing coronal plane assessment. Again, 4 inches from the wall, single leg stand, side bend, come back. What you're looking for is you're looking to see if your patient or client shows a postural change. If they show they have trunk rotation, if they show that they have some sort of deviation from this coronal plane, and they have it on one side and they don't have it when you do the opposite side, that's what you're going to document, and that's actually going to be a corrective exercise. So you are strengthening the core in a functional pattern in weight bearing. Next one is going to be a transverse plane. Single leg stand and rotate. Again, you're doing this bilaterally, toe touch for balance if you need to. Then we're going to get into the single leg stance, the classic Trendelenburg. Again, you're going to be looking for any type of a deviation, pelvic drop, which is going to allow you to assess lumbo-hip-pelvic control. And the very last one is what I will refer to as a stop sign. Single leg stand, go down, touch the opposite knee, and come back up. And what you'd be looking for to see if your client or patient has any type of dynamic valgus, do they collapse their trunk? These are some things that you would look at and assess. These are high level, so these may not be your first choice, but they are appropriate for patients that do have some functional deficits in weight bearing. You can adjust it and have a toe touch for balance or both feet on the ground.